Hello everyone, welcome to the today's class in clinical toxicology. In continuation of previous class on the introduction to the topic and some background information about the clinical toxicology, today we are going to see the most important topic of clinical toxicology syllabus, that is chapter 1, that is general principle involved in the management of poisoning, which gives us the basic idea on what are the basic principles which are involved in the management of poisoning cases. So basically we are having principle 1, 2, 3, 4, 5, 6 principle. That is, first principle is known as stabilization, where we will stabilize the person, we will assess his conditions, vital conditions, then we will correct them, and we will maintain the airway, breathing, circulation and CNS status of the person, that is known as stabilization. Our second principle lie on the evaluation. In the evaluation, we will assess the person for the possible crisis and threats. Then we will check the vitals of the person, we will evaluate them so that we can provide the prompt supportive management. Similarly, the third principle lies on the decontamination, where we will try to remove the poison from the exposed area such as skin, eye, and if it is ingested poison, then we will try to remove the poison from the gut area, that is from the alimentary canal. Similarly, if it is possible and if it is required, we will go for administration of activated charcoal. Then our fourth principle rely on the poison elimination, where we will try to remove the poison from the blood circulation, that is from our systemic circulation. For that, the most prominent method is providing the diuresis. Then second, using the sophisticated devices to filter the blood. In this technique, the most commonly used techniques are hemodialysis, peritoneal dialysis, hemofiltration and so on, where our blood will go to these devices and these devices will filter the blood so that the filter blood will return back to the individual's body. Then similarly, fifth principle lies in the antidote administration. So there are very few antidotes, around 5% of poison compounds are having the antidotes. Let's say less than 10 or 15% of poison are having the antidote. So wherever there is a availability of antidote, we are going to administer the antidote. Similarly, our sixth principle, but very important principle, lies in the nursing care and psychiatric care. So this is fundamental in the admitted, bedridden and comatose patients. So this will help in prevent the sequelae. Then during the follow-up also we can give the proper nursing care. Then the psychiatric intervention also can be given so that the suicidal tendency can be reduced. So now, without wasting much time, we will go to our first principle, that is stabilization. In the stabilization, first we have to assess the condition, what we can stabilize. Right, so first is the assessment of A, B, C, D, that is airway, breathing, circulation and the CNS depression. So in airway, we have to see for some symptoms like dyspnea, air hunger and hoarseness of voice, whether there is presence or not. Then the healthcare professional will look for some signs like stridor, then intercostal retraction is there or not, cyanosis, that is due to the accumulation of carbon dioxide. Similarly, tachypnea, that is fast breathing. If respiratory rate is more than 20, then we will tell it as a tachypnea. Then we have to assess for the concentration of carbon dioxide. If it is more than 45 mm of Hg, it may lead to the retention of carbon dioxide leading to the cyanosis. Similarly, if the pressure of oxygen is less than 70 mm of Hg, this condition is known as hypoxia, which is basically due to the decreased O2 concentration. Then similarly, other issues in the respiratory system are respiratory depression. Some common drugs like antidepressant, alcohol and nicotine may lead to the respiratory depression. And some drugs may lead to the respiratory stimulations. So some drugs which are responsible for this respiratory stimulation are amphetamine, atropine and cocaine. So here what we have to understand means breathing is compromised. So we have to assess for these symptoms whether person is having breathing problem or not. Similarly, in the assessment of circulatory system, we have to assess the pulse rate and blood pressure. Some commonly drugs which are associated with the cardiovascular irregularities are caffeine, cannabis, amphetamine and clonidine. And another important clinical character is the cardiac arrhythmia. Some drugs like alpha and beta blockers, including organophosphate compounds and theophylline. So these compounds will lead to the cardiac arrhythmia. So again, this is a life-threatening condition, we need to manage it. Then another important parameter we have to assess is the depression of central nervous system. So this depression is known as the arousable lack of awareness. We have to assess for this also. To assess the level of CNS depression, we are having several scales, as we can see here: Glasgow Coma scale, then reaction level scale, comprehensive level of consciousness scale given by European Union, then coma recovery scale and Reed's classification. Out of that, the Glasgow Coma scale is the most widely and accepted scale. So in Glasgow Coma scale, total we are having 3 different parameters. One is the eye response, another is the verbal response, another is the motor response. In eye response, how the eyes are reacting, then in that base we are going to score the person. So 4 is the highest score if eye movement is quite spontaneous and normal. Similarly, if the person is eye response is good against the speech, then we will rate him as 3 score. Similarly, if he is only responding to painful stimulus, then we are giving him 2 score. If there is not at all response from eye, then we are giving his 1 score. Similarly, in the verbal one, the highest rating is given 5 score. Then the lowest one is none. Similarly, in the motor, the highest is the 6 rating and the lowest is 1. So 6 means obeys command. Whatever we will say, he will obey the command. But if he is not at all obeying the command with the pain and all, then we are going to give only 1 score. Now here, how we have to interpret this? If the person is quite conscious and normal, he is oriented, then his score will be 15 out of 15. Then if there is a score of 13 to 15 out of 15, then we will say it as a mild altered consciousness. If this level is from 9 to 12, then we will say there is a moderately hampered consciousness level. If it is less than 8, then we will say that person is in the coma state. So we have to evaluate all these conditions in the patient. Now, another is the management. Now here, up to here, we were discussing about the assessment. Now we will see how we can manage this, right? This management of stabilization will also cover the chapter 3. As in first lecture, I have mentioned that chapter 1, 2, 3, 4 and 5 are quite related. They are integrated to each other. Now here, if there is a respiratory insufficiency, then we have to clean the respiratory tract. We have to lift the chin so that the airway tract will be visible and open. Then we have to provide the thirst to jaw so that if there are some obstacles, it will come outside. Then we have to remove saliva, vomitus or blood so that it will remove the choking. This can be done by finger sweep. Finger sweep means we will make our finger like this and we will keep inside the mouth and we will remove it. And if there is a availability of suction device, suction is having one small pipe, we will keep that inside the mouth. That suction pipe, with the suction pressure, it will take out all the secretions so that the respiratory tract will be open and intact for the breathing. And if person is in the hospital facility, we can go for the endotracheal tubing, which will make the process easy for further ventilation process also. Then similarly, we can go with the O2 therapy. At the low concentration we have to start, that is 28%. Then slowly we can increase up to 35%, up to when the pressure of oxygen will reach to 45 to 55 mm of Hg. And while managing the circulatory failure, we have to manage the acidemia condition. That this acidemia is actually leading to the cardiac failure. We have to elevate the foot so that blood will come to the vital organs so that the person's life will persist. And we have to open the IV by giving cannula in the veins, and we have to use the 16 gauge cannula. This is very thick cannula which is generally used to transfuse blood. It means that if we need rapid hydration, we can give the rapid fluid so that the person's life can be saved. Similarly, we have to go with the electrocardiogram where we are continuously monitoring the rate and rhythm of heart. Then if the BP is low, we have to go for the vasopressor therapy. So in vasopressor therapy, first is the dopamine. So this dopamine is the cardiac inotropic drug. Rather than inotropic drug, this dopamine will increase the contraction of heart. So where we will use 1 ampoule of dopamine, that is 200 mg. We will dilute it in 250 ml of 5% dextrose. Then at the dose of 1 to 5 mg per kg, we can per kg per minute we can give to the person. If required, in the serious case, we can increase the dose up to 15 to 30 mg per kg per minute. Up to when we have to do that? Until and unless the systolic blood pressure will rise to 90 mm of Hg. So this we have to do. Then if there is unavailability of dopamine or if we are having availability of noradrenaline, then we have to go with the noradrenaline, that is 8 mg. 1 ampoule of noradrenaline will contain 4 mg. Now 2 ampoule we have to add in 500 ml 5% dextrose. Then at the rate of 0.5 to 1 ml per minute, we can administer the noradrenaline. If it is required, we can repeat the dose. We can continuously repeat it until the blood pressure is increased. Similarly, if there is cardiac arrhythmia, first we have to obtain the ECG and we have to provide the oxygen supplementation. If there is a hypoxia condition, acidosis or electrolyte, which are the main culprit for cardiac arrhythmia, we have to correct hypoxia by giving oxygen. We can correct the acidosis by giving sodium bicarbonate. We have to manage the electrolyte. If electrolyte are high, we can reduce them by certain measures we will discuss in the another segment. Then if these are low, we can replenish them so that the cardiac arrhythmia will be corrected. In the severe cases, we can go with the lignocaine 1.5 mg per kg IV push. So this dose can be improved to 3 mg per kg based on the requirement. The another compound we can use is the atropine, that is anticholinergic drug, which will enhance the cardiac rate. So this is used to treat the bradycardia. Then similarly, if person is having the CNS depression, we can use the mixture of drugs called coma cocktail. So this basically contains the dextrose 50% solution, 100 ml preparation will come. Similarly, thymine, that is vitamin B1, it will come in a dose of 100 mg. Similarly, the naloxone is used to antagonize the effect of opiate conditions. So what these drugs will do means, now this dextrose will help in curing the hypoglycemia situation. Then this thymine will prevent the encephalopathy and the neuronal integrity will be maintained by the thymine. Naloxone, if there is an opiate overdose, this naloxone will take care of it. And if there is acidosis and hypoxia condition, 100% oxygen will work for it. Then these 3-4 are the main reason which will make our person CNS depressed or unconscious. So if person is unconscious or in the coma state due to these reasons, while we are administering the coma cocktail, the person will come out of coma. So now let's summarize the stabilization once again. So in the today's class, in the stabilization section, what we have discussed means, in the stabilization there are two important parameters in the stabilization. First is the assessment. We have to assess, basically what we need to assess. We have discussed what we need to assess, that is A, airway, B, breathing, C for circulation, and D for CNS depression. That needs to be assessed by various means as I have discussed in the class, right? And then we have to, this is the assessment phase. Then we will go with the management phase. In the management, we have to manage the respiratory system, generally by giving the O2 supplementation, right? Then another is the circulatory failure. We have to correct the acidemia. Then we have to go with the vasopressors. In vasopressors also, we can go for the dopamine. We can go with the noradrenaline. Then similarly, if there is a cardiac arrhythmia, we have to go with the management of acidosis, hypoxia, and electrolyte maintenance. We have to do majority time. It will correct itself. But in some cases, the lignocaine is used to correct the cardiac arrhythmia. This lignocaine also we can use. And some other situations, what we have seen means, there is a condition of CNS depression which will lead to the coma state. This will lead to the coma state. Person will go unconscious. In that way, we will use the coma cocktail. Coma cocktail is having dextrose 100 ml, 50% dextrose. Then vitamin B1, that is thymine 100 mg. And finally, we will go with naloxone 2 mg. So these, along with O2 supplementation, if it is required, this will help in recovering the coma or unconsciousness patient. This is how we have to assess the person for the stability, and we have to manage the emergency condition so that person's condition will be stabilized. So this is all about stabilization. In the next class, we will be seeing the another principle of the management, principle involved in the management of poisoning, that is evaluation. So after evaluation, slowly we will discuss about decontamination, then elimination, then antidote administration, and finally nursing and physical care, right? So soon I am going to share these notes in the PDF format in the Telegram channel. So I request all of you to join me in the Telegram channel also, so that I can post some notification regarding YouTube videos and my notes, and you can get it from there. So I have opened my channel with the name of Dr. Cleanres notes. It's there. I will be sharing that in the pinned comment or in the subsequent video. So soon I am going to upload the notes also. If you are having any suggestions, so you can let me know. With that, thank you for attentively listening to today's class. Meet you soon in the another class. Thank you.